Hello and welcome to Talk Richmond, a podcast brought to you by Richmond Council and hosted by me, Councillor Jim Millard. In this week's episode, I'll be talking about adapting to the new normal as lockdown measures relax, but the threat of coronavirus remains. Our guest this week is the Director of Public Health at Richmond Council, Shannon Coutinho. Hello, Shannon.
Hi, Jim.
Welcome. How are you?
I'm very well, thank you. And
Brilliant.
Thanks for inviting me to Talk Richmond.
It's a great pleasure. Shannon, you were announced as the Director of Public Health in Richmond in April, and this, generally speaking, means you're in charge of improving and protecting the health of residents. Now, the first thing I wanted to ask is, you had previously worked at Public Health England and in the Centre for Infectious Disease Surveillance and Control. What was that like?
Yes, thank you. I trained to become a public health consultant in London and Surrey, and I spent several years working across the national and regional public health system.
Okay.
And my time with Public Health England was really interesting. I had the opportunity to lead on a wide range of health protection work, including preparation of the National Cold Weather Plan for England. This is a plan that helps the country to put measures into place to prepare for the winter months and to protect vulnerable people during cold weather. I also did some work around tackling TB infection among people in detention settings. TB is still an issue, particularly for London. And I led on a big piece of research to understand illness that's caused by salmonella. So I had a really good experience working in Public Health England.
Brilliant. And presumably, having this experience, who was to know when you first started at Richmond that this was going to be such a vital part of what was to come?
Yes, and I know I've heard some people say that this is, maybe an unenviable time to be appointed in any public health role, never mind Director of Public Health, given the biggest health protection crisis that I think we faced in a generation. And whilst I agree it's challenging, as a public health professional, I think this is a huge task, but an opportunity to protect the residents of Richmond by doing absolutely everything we can to stop the spread of infection and try and prevent more people from becoming unwell or sadly even dying from COVID.
Yes, obviously the next stage is that lockdown measures are starting to relax, and it feels like we're beginning to enter this phrase, the new normal. What does this look like for Richmond?
So coronavirus is the one thing that has got everyone talking about public health, which in some ways is positive, but it's also changed our lives in many different ways. I think it's affected us, at a personal level, professionally, in terms of how we work, how we live and travel. It has also improved our understanding of disease and how it can affect different groups of our population, potentially in different ways. So in terms of a new normal for Richmond, I think this will probably include more people cycling or walking for shorter journeys. And I think this will be a benefit to their health and to the environment. More people will be washing their hands, I'm pretty sure, and maintaining good hand hygiene. And this will have quite a positive impact for us in terms of the flu season if people continue to do that. More of us are working from home now, and I think for some people this will have a positive impact on work-life balance. Unfortunately, the risk of new infections and pandemics is still with us and is ever present. So we need to continue to follow the advice and be prepared to make further adjustments to our lives in terms of, changing how we've been used to doing things before. And I know that some people who are particularly vulnerable to COVID, or some of the people who were so-called shielding during this time to protect themselves, will continue to be concerned going forward about their risk of infection, not just from COVID, but from other diseases. So we'll need to do a lot of work to support them to build their confidence and try to sort of reintegrate themselves into the wider society.
Yes, I was going to ask that. How has this crisis impacted the NHS and people with other health needs, quite apart from those who've actually got the disease and have had to struggle with that? But what will be some of the key challenges in overcoming that?
Yes. So one of the things that has happened is, the stay-at-home message has been really prominent and really successful. And so a lot of people have adhered to that. The downside is we know that there are people who potentially needed help from the NHS and other services who have stopped seeking that help that they need. We now have good measures in place to allow services to reopen in a safe way and potentially provide people with life-saving treatment or urgent treatment that they need. I'm also particularly concerned about our immunizations, routine immunizations for the young babies and also for other young adults that, would really like to promote people to now go out there and get the vaccinations that they should be getting, because of course there are other diseases about in addition to COVID, and that's really important. And the last real challenge that might take some time to reveal itself, I think, is around mental health issues. A lot of people have been feeling isolated or lonely. There are people who've been feeling anxious, depressed, either as existing conditions or, as a result of COVID. And through the turn of time, I think, this will come to the fore, and we'll need to ensure those people can access services.
Absolutely, absolutely. I mean, I've personally felt very lucky that we're in this borough. We do have quite a few open spaces, the Riverside and other places that we can sort of head to fairly easily to get some exercise and some fresh air, because for everyone, I think there's been a real challenge on that. Just being cooped up inside is an unusual challenge for everyone's well-being.
Well, it has really taught us to appreciate the simpler things in life, I would say.
Yeah, and it's good to look for those silver linings. I agree, definitely. So coming back to how this is, all panning out from your point of view, how obviously we've got this sort of looking ahead, we're looking at test and trace. How is that working so far?
So test and trace is really important, and it involves people who've got symptoms going on the NHS website, booking themselves a test. Obviously, whilst they think they've got symptoms, they do need to stay at home for 7 days, and anyone else in their household needs to stay at home for 14 days. And once they've booked a test, they will share details about contacts that they've had during the time that they might have been passing on the disease. And then these people will be contacted once a positive test result has come back for that individual. So if someone is a contact, you can expect that you might be alerted by the NHS test and trace service to say that you have been in contact with somebody, and then they will talk you through what you need to do. You'll probably be asked to begin self-isolation for up to 14 days, depending on when you last came into contact with the person who has tested positive. And it may be the case that you go on to develop symptoms of coronavirus, and other members of your household would then be asked to self-isolate at home, and you would need to book a coronavirus test as well. So I think contact tracing in itself is nothing new. It's a public health approach that's commonly used for managing any outbreaks of infectious disease. And now we've got this really good national service which is trying to do that by providing remote support, allowing people to book themselves in through a website and to get a test kit sent out to them.
Brilliant, brilliant. And how do you think it's panning out? Is it being helpful to you?
I think it's working really well. As a local public health team, we are linked into this wider system. So it's really helpful for us to understand what's happening within Richmond and with our local residents. And if needed, then we would collaborate with Public Health England and other partners to all sort of wade into that response and ensure that we protect residents and we stop any further spread of infection. What I would want to do is to reassure local residents that we've come on a long journey with coronavirus. We had instances where we were having at the peak up to 19 cases being notified within a day. We're nowhere near that. We continue to watch the situation really closely, monitoring our figures really closely on a daily basis. And we are genuinely down to really low numbers of cases, which we might refer to as sporadic cases.
Thanks, Shannon. And really, I think it's so important that we understand that we are going into a sort of a slightly more relaxed phase. But what do people need to do to stay healthy and to avoid a second peak?
Yes, absolutely. This is a really important question, and I've got a few suggestions. I think the most obvious thing that we can all do is we need to continue to follow the latest guidance on social distancing. We're not out of the woods yet. And whilst there has been relaxation to some of the measures, we all need to continue to socially distance. Good hand hygiene. I think this is a permanent life-saving skill that we've all learned. So
Mm.
whether we've got coronavirus or not, we need to keep washing those hands all the time. There are other measures that have come into place, for example, around wearing face coverings in public transport or in other confined spaces where social distancing is maybe not so easy to achieve. And again, this is a legal requirement, but also our personal and public duty to do. So we need to follow that. Now, just moving on to thinking more about the changes that have happened to our lifestyles and how we live and work, I think it's important for people who are now working routinely from home to try and develop some healthy routines to enable them to keep physically healthy and mentally well. So the first thing is we all need to try and do some physical activity. I think it's important that you carve out some space just so you can have a bit of a stretch and a break. This will be good for you. Now that we're spending more time at home, I think it's an excellent opportunity for us to try out some cooking skills, try and cook some really good homemade food from scratch, try and eat a more balanced and healthy diet, because after all, I think we've got a bit more time to do that. And I think the last thing I would say is just to remember that what's good for the body is good for the mind.
Great advice. Thank you. What's your lockdown routine?
So it's a really challenging time, as you can expect, for a director of public health. And I tend to have really long days. I wake up quite early. My day starts just after 5 in the morning, and I go for a 4 mile run. I try to do that on at least 4 days a week, and then give myself a little bit of a break. And then I think that just helps to calm me and set me up for the day, lowers my blood pressure, and I'm ready to face the challenges of the day. During lockdown, I have on some days taken my two young children out on a bicycle ride around the local neighborhood. So on the weekends, I tend to do a little bit of gardening. I've got some roses, a whole row of roses that I planted last year, and this year they're coming up. So I do quite a lot of pruning, rose feeding, watering them, making sure that they look good and healthy. So that kind of gives me something to look forward to.
Any cooking tips for the lockdown?
So cooking tips for the lockdown, I would say try to do a balanced plate, lots of veg. Obviously, we're getting into the hot season, so I think it becomes easier to eat lots more salad. And so I think the more colorful your plate is, the healthier it's likely to be.
Okay, good stuff. That was a really interesting discussion with Shannon. His background and experience reaffirms my confidence that we are in very good hands. It's a confusing time, and the amount of information out there, as well as the ever-changing guidance, means it can all be quite overwhelming at times. I hope that this episode has been helpful, that it has given you a better understanding of test and trace and some helpful tips on what you can do to remain healthy. I think it's worth reiterating the importance of continuing to social distance, to wash your hands, to wear a face covering, and to stay at home if you have any symptoms. For further information on the topics discussed, check out the show notes below. If you have any questions, email us on talk@richmond.gov.uk. Please like and subscribe, and do give us a review. We want to spread the word. This is a new way of getting information out, and 5 stars would be very welcome. I'm Jim Millard. Thanks for listening.